Hello, I'm Dr. Bang Jisung, the hair specialist who protects your hair. It's good to see you all. Today, we're going to discuss the 3-month progress. Around the 3-month mark, patients start to look a bit more relaxed. That's because you can really feel something growing in the areas that were previously bare. If you're really lucky and your hair grows fast, the sides might even start to look dark. We usually transplant a lot of hair here, in the temples, right? So in this area, you can already observe a shading effect, and it might even start to look like a hairline. So, at the 3-month mark, as I often say, this is typically when the area my hand covers begins to show real improvement. So, at the 3-month mark, if this area is getting better, it implies that the inner scalp area is still empty or bare. Even when it begins to grow, the inner upper sections might appear noticeably sparser or thinner compared to the sides. So don't worry too much. Since it's growing from the sides, just think, it started. I've gotten off to a really good start. That's probably how you should think about it. For men, having growth on the sides is great because when your hair is a bit short, this area is exposed. So after the surgery, they're so happy when they see this part filling in. And so, when we check their progress at the 3-month mark, the patient is already happily smiling. I'm serious, they're genuinely smiling. They're just so happy with this area. They're very pleased with the progress. Since you can always comb over the hair on top to cover it, having just a little bit of growth here visually makes you feel a significant change in your appearance. So at the 3-month mark, your sideburns and temples will be improving, but the inner scalp area will still be empty. That's what I'd convey to you. There might be some slight differences between patients, but at 3 months, the back of the head shows almost no signs of surgery. As the photos reveal, by the 3-month mark, it becomes virtually impossible to tell if surgery was performed or exactly where the hair was harvested. So at 3 months, you can cut the hair at the back a little shorter if you want. You can style it however you like. For me, when I am harvesting, I generally avoid taking hair from below the middle of the ear. I do, because that area could be prone to hair loss, and if you have a short haircut and it's exposed, it can be quite upsetting. So I make an effort to completely avoid harvesting from that specific region. At the 3-month mark, the biggest concern is this inner scalp area. So once this area starts to fill in, you might begin to worry if other regions have problems or if they'll ever grow. But as I've already told you, if you can feel something tangible here and it has a slightly prickly texture, then you're perfectly fine. However, if you don't feel that prickly sensation, then you should observe it closely. Later, you can check if that particular area eventually becomes prickly. Therefore, even though the amount and speed of growth vary, initially, you should consider this area as just beginning to show growth, with merely a faint trace of it present. And it would be most beneficial to consult with the clinic where you underwent the surgery, discuss any worries you might have, and then keep an eye on your progress. Thank you.